Thank you, Mr. Chairman. Mr. Secretary, I wanted to raise what I'm hearing from thousands of constituents who are very concerned about the mandate requiring masks for young children and toddlers in Head Start programs. We know, based upon recent studies, that masks on young children cause limited vocabularies, delayed speech development, and difficulties with social interaction and confidence. In addition, we know that face masks disrupt holistic processing and face perception in school-aged children. Even the World Health Organization states, quote, children aged 5 years and under do not need to wear masks. Children of this age should not wear masks for a long duration. We know on the ground from constituents that this rule is still in place. The CDC revised its guidance on February 25th, indicating that masks are no longer necessary in the vast majority of this country. Why is your agency still imposing this harmful mask mandate on toddlers and young children in the Head Start program?
Congresswoman, thank you for the question, because obviously we're still within this pandemic and it's a very salient question. What I would say to you is that we know that masks are safe and they are effective. We know that many of our children, especially those that are under the age of 5, can still not receive a vaccine, and so therefore they are in danger of contracting COVID. Hundreds of families across this country would tell you about how COVID does hit those under the age of 5 because they have lost their child to COVID. And so we're going to do everything we can to make sure those children are protected. When you have something that's safe and effective like masks, they should be used. And we obviously understand that the science is guiding us on the actual implementation of those policies, but I will tell you that there's no contradiction in the fact that that masks have proven an effective way to help control COVID.
So the position of you, Mr. Secretary, and the position of President Joe Biden is to require masks on children under the age of 5, which science in fact proves the masks hurt children, both in the development, whether it's intellectual development, speech development. That is the position of President Joe Biden.
Congressman, as you know, many Head Start programs—
It's a yes or no question. Is that the position of President Joe Biden? You are the cabinet secretary, so the position of this White House, this administration, is to require masks only at this point for children in the Head Start program. There's no requirement for masks at K through 12 across this country. So now we're in a position where the only mask requirements, and we know that science shows that those least impacted by the COVID pandemic are the youngest of young children.
Congressman, the policies that the president has espoused and that we implement are to make sure everyone is safe and effective using the most proven methods possible, and that's what we will do. Head Start, we are reviewing the policies as we speak, but we will make sure that we're protecting every child in America under a Head Start program, since Head Start is funded primarily through federal dollars.
Through taxpayer dollars, taxpayers who do not support this mask mandate on children in Head Start, on our youngest of young children, who the mask mandate is hurting the most. So my question to you is specifically, what scientific studies are you relying upon? Are you saying that the HHS position is different than the CDC guidance? Who are the experts in HHS that are circumventing and coming over the top of the CDC recommendations?
Congresswoman, I can only show you the evidence that we have, the studies that have been done, the accumulating evidence that we've seen that show that a child wearing a mask is safe.
Who are the studies conducted by? Who are the studies conducted by? And do you believe the HHS has the authority to make a different decision than CDC, different recommendation than CDC?
Congresswoman, I'm more than welcome to share with you the studies that have proven that wearing a mask, if you're a child, helps, it's safe, and it's effective. We are looking at studies that have looked at children at the age of 2 years, and we've been able to show that, in fact, making sure that Americans use masks.
What do you say to the studies about the speech delay? What do you say to the studies about how, in fact, the transmission rates and the negative effects of COVID is the lowest of the low when you're talking about children under the age of 5? What do you say to those studies?
Congresswoman, the accumulating evidence on child mask wearing is showing that it does not impact their language or emotional development.
It shows that it doesn't work. This is by World Health Organization.
We each can have our opinion. Congresswoman, you're entitled to your opinion.
Mr. Secretary, you are wrong in this position, and if it is the position of Joe Biden to require mask mandates only on children under the age of 5, that is woefully out of touch with the American people. It's also woefully out of touch of health experts across this country. I'm glad you clarified that it is this president and your agency that is circumventing the best scientific and medical advice to impose these harmful mask mandates. I yield back.